I need to fix my hair. But yes, so hi everybody. I'm finally making my YouTube video. Yay! So I finally have time to sit down and actually make this video because in a few weeks I'm gonna start RT school part 2, second semester, and boy oh boy oh boy is that gonna be a blast. 4 classes plus clinicals, so guess who's gonna be really busy? That's right, you, because you're watching this, but me, because I'm gonna be tortured with a lot of tests, case studies, and OMG. But I wanted to make an intro video about myself and kind of introduce myself and what's kind of like my background and all that good stuff and why I chose RT school. So basically, to start off, if you don't know who I am, my name is Michelle. I am a respiratory therapy student in Texas. Yeehaw! And I am a first year respiratory therapy student, and I survived my first semester. Going to my second, I'm actually working on some clinical stuff that I want to put on my clipboard. This is not my official draft, but it's kind of like my rough draft of what I need to put on there and what is important. So I've been working on that for a while. So yeah, that's what I'm doing right now, kind of reviewing what I learned in the past, and the enzyme test and the coagulation studies, and all that fun stuff. And yeah, so I'm like I said, I'm a first year student going to my second semester, and I've learned a lot within this past semester. I thought I knew everything, but I don't. Plot twist. Our professors are amazing. Our program, the first semester, it was only, depending on which program you're in, my program is only 2 classes in the fall. So you could get ready for clinicals the spring with the other 4 classes. So it's like, interesting. So they're just trying to test ball us and kind of weed us out, what they call weed us out, of who's going to make it to the program and who's not. So luckily I survived, so which is good. But yeah, so a little bit more about myself. Before RT school, I volunteered at a local hospital where I live at the gift shop, but I was able to go speak to patients in regards to some information that they could get and their medical records. And so I was able to see how the hospital works around that. So it's just pretty awesome. I liked it. I got to see ICU, I got to see telemetry, and I got to see like all these different floors, and I was just like, wow, I know what I'm getting myself into now. So that's pretty cool. So besides volunteering, I also used to work at a local pharmacy, which they had a section where it was durable medical equipment. So I was able to learn about oxygen prior to going into this program, about the tanks, when it needs to be tested, how to use the cannulas, when to use the cannulas, and the teach bag method to the patient, and then they teach it back to me. So I learned a lot about patient communication with the doctors and the nurses and all that stuff. So I thought that was pretty cool too. So going into the program, I do recommend, if you're watching this video and you're thinking about going into the respiratory therapy program, maybe go into like something with medical terminology. That helped a lot for me too, because I took that class for another program that I was applying for, and it helped me out in the long run, which was awesome. What else? So those are kind of like my background stories of what I have worked for me in the program and how I got accepted. The day that I got accepted was July 7th into the respiratory therapy program, and I also had applied to another program for radiology, and I did get accepted to that one too, but your girl decided to go for respiratory because respiratory is best. No, I'm just kidding. In all seriousness, all healthcare careers and all the professions are amazing, from the CNAs to the environment team, all the way to doctors, the physicians, all in that spectrum is amazing for the healthcare team. So I thought it was pretty awesome. So I got accepted to both programs, but I chose to be in the respiratory therapy. But that's a little about me. I could go into more detail, but pish posh, right? So why respiratory? Because I did say that I applied to 2 programs. but I decided to go for respiratory because I thought it would be better for me as person, you know, for my own being. I am a people person and I love being around people. So I decided that I would get more patient interaction as a respiratory therapist than a radiology tech. And that's what I kind of like. And then being able to make my own choices, you know, in regards to like what the doctor's orders, and being able to tell them, hey, you know what, I think this needs to be changed because of this. I could put my opinion in there and he'll be like yes or no, or he'll reject it, or at least I get to be able to talk and give the right treatment for my patient at the right time. And you know, what benefit for the patient and not for necessary, or if it is, I like that opinion personally. Another reason why I like that specific system, the cardiopulmonary system, the lungs and the heart, pretty amazing. And there's a lot to it than just breathing and pumping blood, right? So I just thought it would be really interesting to study that one specific system. And the lungs, you know, it has its own little branch of complications, and it's a lot to learn, which I totally love, and I would continue to study forever and ever because I just love it. There's a lot of changes in the medical field, and it's just really great. But that's just why I chose respiratory therapy. A lot of people say that it's good pay, and a lot of people say it's like, oh, it's better than nursing, but realistically, the healthcare professions, they all have their ups and downs. But just personally, it depends on which one you prefer. Me personally, I just chose respiratory because it seems like the best option for me. One specific system and be able to master it. Maybe, who knows, I'll become a nurse. RN or RT. Who knows? There's always that benefit too. But yeah, so this is just kind of like an intro video about myself, and I finally made this YouTube video so that you guys get to meet me and how I am. And I am pretty spunky, so I get to talk a lot. And I just wanted to introduce myself before I did anything. So hello and goodbye until the next video. See ya.